Welcome back to the Redemption Physical Therapy Podcast. I'm Frederick,
I'm Marissa.
and today we are talking about how all PT is not the same. All physical therapy treatment is not created equal. We're going over one of the clients that we've worked with in Redemption Physical Therapy and how their specific shoulder surgery almost went bad because they decided to go and do insurance-based physical therapy. Now, before we get into the details, we're not saying that all insurance-based PT is bad at all. We're just saying that sometimes when you go to an insurance-based clinic, you end up having treatment that isn't specifically one-on-one, isn't specific to you, like you get just a cookie cutter program. And also, you have workers who just may be overworked there. Because they have to get in a lot of patients. So they can't give you that one-on-one care that you might need. They can't really fine tune your program to your specific needs as well as it could be. But then there are some times where you really get good therapists there and they're not overworked and they can really hone in on you. So we're not saying that all of it's bad, but if you do recognize these patterns, when you do go to an insurance-based PT clinic, try to find a way to get to a clinic to where you can get really good individualized care, and they are tailoring it to what you are trying to get back to. Okay, so I just wanted to say that because we support all of our physical therapy clinicians out there. Okay, and we're not trying to bash anybody, but it is the system that we have to try and work around. So we just want to give you the most information you can. So when you go into these facilities, you understand what you're getting into. Okay. All right. So now let's get into the specifics of what we'll be going over is the biggest mistakes in post-op rehab, what accelerated the recovery of this shoulder injury, what that really looks like, and then also why one-on-one PT actually matters or just really matters the most. Okay. So this specific person had a full thickness rotator cuff repair. All right. So they started off in an insurance-based clinic with minimal progress and high pain, and then fear that it was, starting to regress and not actually get better. So after about 8 weeks of this post-op, they came to Redemption. And then that's when they started working with Marissa here. So when you first saw him, what immediately stood out as a red flag about the care he'd been getting?
So yeah, he was about 8 weeks post-op, which is only 2 months. So he's still in the early phases there. And there is some range of motion protocols that you have to follow after a post-op, like a patient or especially rotator cuff. However, he was pretty behind in restoring his range of motion. So his joint was getting stiffer by the minute, even within the protocols that are set by the healing timelines and the surgeons. He was behind schedule, and also he was still in a great deal of pain. Again, surgery, it's very traumatic for the tissue and for the joint, so pain is expected. After 8 weeks, I mean, he was still not sleeping at all through the night, which is tough for healing. But also, like I said, that's a high level of pain at 8 weeks post-op that's not being addressed, right? So that was kind of another big red flag. And in my head, it was like, not only are we behind in range of motion, but he can't even get sleep to allow his body to heal because he's in so much pain. So again, it's just a vicious cycle. You're in so much pain, so you can't sleep, which is decreasing your healing, which is increasing your pain, and it just, you know what I mean?
Yeah, yeah.
So that was going to be a problem if we couldn't manage it.
Okay.
Yeah.
Got it. So the pain, he should not have been in that much pain that far out.
Yeah.
In the range of motion, he was behind on those like two specific things that you definitely want to address.
Yeah.
Right. Okay. So what was your number one priority in those early sessions?
So during post-op, like especially early sessions, one of them is like gradually restoring range of motion, right?
Okay.
So we want to get that again, staying within time frames. There's certain motions that are going to stress that repair more than others, so we're prioritizing other means or other directions,
Okay.
right?
Yeah.
But yes, that is the main, prioritizing that, and then also kind of gradually starting to reactivate some of the tissues, whether it be around the joint, or if, like I said, if it's a shoulder, then we're gradually reintroducing elbow movement, that type of stuff. But then slowly reactivating the muscles, like with some isometrics, which we've talked about, kind of just gentle like pushes, actually creating a little bit of muscle tension without having to move the actual joint.
Yeah.
So those are early stages. That's kind of where our priority lies. And of course, pain management,
Yeah.
right? Swelling management, trying to normalize all of those like healing type processes,
Yeah.
right? Is going to be important.
So and you also say like what you're doing anyway, like when you do that range of motion, when you do that those isometrics, you are still addressing the pain, but indirectly,
Mm-hmm.
right?
Yeah,
Yeah.
absolutely. Yep. Blood flow, circulation,
Hmm.
movement. Yes.
Yeah.
Joint lubrication, all these things. Yeah.
Yeah, I think it's good for people to know that because a lot of times they think about like if they're already in pain with certain movement, that more movement is just going to cause more pain.
Yeah.
But it's like it's movement with the purpose of getting you out of pain,
Right.
right?
Absolutely.
Yeah, I kind of like that one. All right, so the next thing is how did you reintroduce strength without putting the repair at risk?
Yep. So starting with the isometrics, right? The just kind of the pushes, the activating the muscle tissue without actually going through ranges of motion, right? That's always where you tend to start when it comes to post-op, right? It turns into active assisted motion, and again, this is gradually, this relies on one, where the patient is, two, the post-op time frame, the healing time frames, and the type of surgery, right?
Yeah,
Again, there are specific uh, guidelines that we need to follow when it comes to like certain motions will stress a repair more than others, right?
right.
But moving back to my point, moving from like pushes, right, to maybe active assisted, where we are actually moving through range of motion, but I'm assisting,
Yeah,
so maybe we're doing like 50% of it, actual like muscle activation, I'm helping with the rest.
yeah,
Then it'll move into like literally moving through range of motion on your own without assistance. But now we're using 100%. No weight yet,
yeah,
right? But, can I get my arm overhead without assistance?
yeah,
Then we start loading, gently, gradually loading, and it starts pretty basic at first, and that's what it did with him. What are we loading? Are we doing bicep stuff? We start to get into just gentle banded rotator cuff stuff once we can. Forward raises,
yeah,
lateral raises. Like
yeah.
it starts with basic movement, just getting the person able to move their shoulder, or him
Hmm.
to move his shoulder in normal functional patterns, right?
So, so you're saying these things like it sounds like these are basic things.
Mhm.
Like these are basic things that need to be done. But what was going on in his treatment? Like, did he give you any idea of like the exercises that he was getting, or
So
was it not?
yeah, so where he was specifically, there was a volume problem for sure. You know what I mean?
Okay.
So, in regards to the range of motion, was he getting the amount of manual techniques that he needed to get his range of motion back? Maybe not. You know what I mean? So there was his PT was seeing a lot of other people. It makes it challenging. Which also makes it challenging to gradually progress someone. If you're doing the same exercises, and that was another one of his complaints. He was doing these same things over and over and over again. And he's like, first of all, I can do these things at home. Second of all, they're not getting harder. You know what I mean?
Mm,
Which again, there is a time frame, right?
yeah.
Based off of what he was telling me, it was kind of it seemed a little bit more of like an oversight versus we're following a protocol,
Right.
right?
Yeah.
I didn't meet the PT. I don't know the PT,
Yeah.
so I can't say that for
Yeah.
sure.
And we're not
But
naming names. Like
speculatively,
it's
yeah,
okay.
yeah.
Yeah.
So like I said, that was where he was, and even so he actually came to me 8 weeks, and he continued with the insurance based place through me as well. So he was getting both. He was just splitting. He would go 1 and 1 instead of like seeing them 3 times a week, until they got him to a reassessment phase where they could submit the note to the doctor. And then at his reassessment, he told the doc, I'm not going there anymore. I'm going to Redemption. So he was kind of half and half. And that's where he really was like, this is so different. He's like,
Mm.
because at the clinic, he's like, I'm using these like pink 1 pound weights, right. And where he was in a phase where he was much past that.
Yeah.
Right.
Yeah.
At 8 weeks, we weren't loading a ton. But
Yeah.
again, he continued to work in both places for a short period of time. And that's where he started to notice like what I was doing was way different than what he was doing in the other clinic. And that ultimately was like, he was like, finally was like, yeah, I'm not, I told the doc I'm not going there anymore at all.
Yeah.
So, and the doctor approved. So,
Gotcha. And okay, so that it makes sense because again, this is like why I didn't want to work in a clinic that like I had to see maybe like 4 to 3 patients at a time, which is insane. Um, but also like just like you said, it could have been a oversight, right?
yeah.
To the point where it's just like, okay, oh, you're back, you're coming in again. Okay, these were the exercises I gave you last time. Go ahead and start with those, and then we'll probably progress those. And then they get caught up with another patient, and then they don't even get to progress the exercises with the patient that's right in front of them that day.
Right.
Then also, like you said, with now you get the manual techniques that you can add on there because maybe they need to push through a little bit, and they're not going to push through on their own
Right.
for certain things, and especially like post-op, and you have to be like you're more cautious than they would be, so you can keep an eye on those things. So they may be more fearful on their own to kind of push that range of motion than you would because you know what they should be able to tolerate and what the feel is like as well.
Yep.
So that goes to show like just the understanding of like why that one-on-one time is really important, especially for post-op issues.
Yeah.
If you're going in like you have some knee pain, some chronic knee pain or some chronic back pain, then those places like might still work okay for you because you just might need some basic exercises, right?
Right.
And you can get away with, okay, do these, and then I'm gonna go to this person, and we're good to go, and you're good, and you're feeling better. But post-op, like a traumatic injury, you need that really, really individualized care.
Yeah.
Yep. Yeah, so I just wanted to like kind of reiterate that point too. So going into the next thing here, so he had a demanding job, or he has a demanding job. So how did you prep him for that job to get back to work?
Yep. So just knowing, he was in law enforcement. So knowing, and this comes from talking to your patient, talking to your client, right? So knowing what his demands are, knowing the role he plays where he is at work, knowing, throughout the process, like, so that's another thing, kind of this oversight, every session that I do is almost like a reassessment. That person comes in, I'm like, okay, well, how's this? How's this? How's this? What are we still having problems with? Like something that you may not always have time for in an insurance-based clinic.
Yeah.
If I got 5 clients, I'm just like, how you doing? Oh, still in pain? Okay, cool. And moving on. Right? So it's shitty, but that's how it happens. So like being able to talk to your clients and like figure out, okay, this is what we need to get back to for your job, right?
Yeah.
This is what we're still having problems with. How is that going to affect what we need to do to get back to your job, right? It's just and then at that point it's easy in a sense, right? Like it's easy because it's like, okay, cool, I have a extremely clear picture, and hopefully my schooling, I know exactly what I need to do for this person.
Yeah.
So once we get to the point where like we're kind of out of the danger zone of like disrupting the repair, we start to build the foundations based off of what he'll have to do at work. You know what I mean? Especially like for law enforcement that's on patrol. I mean, his shoulder may have to take impact.
Yeah.
You know what I mean? He's got to be able to sprint.
Yeah.
And that seems lower body. Not if you're swinging your arms rapidly. You know what I mean? So certain things like that, like he needs to be able to do, and that we built his program foundationally, and then progressively to be able to withstand those demands.
Gotcha. So what would be like just once you kind of got past that? protecting the repair phase, and you got into the phase of, okay, like, what do we need to get you back to for your job? Like, what might have been some of those things specifically for him?
Hmm.
What were some of those things?
Yep. So for him, eventually, like honestly, we go through the basics, like
Yeah,
strengthening in these open kinetic chains,
yeah,
right? But because he is in law enforcement, like there may be times where he has to take load through the shoulder, through the arm. They have to take people down occasionally. They get into it's physical scuffles.
yeah.
So getting into like weight bearing, or even just like higher impact, where I had him on like Bosu balls, and I'm pushing and kicking him around, and
Okay,
you know what I mean,
you were
within a
kicking him.
professional manner. But yeah, like getting his shoulder to be able to somewhat tolerate the unpredictable.
Okay,
Right.
yeah,
So a lot of that stuff like that. Right. Of course, we're still strength training. We're doing a lot of that. But yes, his program started to consist of, a lot of sandbag stuff. So
okay,
like heavy type holding where he may have to be kind of
yeah. You got to
restraining.
restrain someone.
Yeah,
Yeah,
exactly, right? They do have to work with firearms. So
yeah,
no, not only did we work that position, but we worked like his shoulder being able to take the impact from
mm,
the
mm,
firearm. So a lot of like, shoulder blade type movement, but again, under load, we were loading it. We were making it so I was creating chaos, while
mm,
he was doing these things. So I think in law enforcement, it was a lot of like, can his shoulder take the unpredictable, and that was what I implemented in, right? So it
okay.
was a lot of manual perturbations.
Ah, okay. So you did a lot of manual stuff with them
Yeah,
too, like
yeah,
dynamic manuals,
yes,
stabilization movements and stuff like that.
yep.
But then also, like you said, with the strength stuff, it's just like it could be basic like push-ups.
Oh yeah,
Like,
push-ups. He
and
was
you said a
bench
lot of
press.
open chain too stuff.
Yeah,
So
we started with a lot of open
yeah,
chain just to build the foundation,
right.
right? I built his delts back up with forward raises,
Yeah.
lateral raises,
Yeah.
bent over rows. You know what
Okay.
I mean?
Yeah.
But yeah, he did. He got back into push-ups. Even bench press.
Yeah.
Again, we think of some of the things that these law enforcement have to do. Yeah,
Yeah.
they're not up here a lot, but they do a lot of impact work here. So yes, working through that is, that stayed in the program. The strengthening
Yeah.
part stayed in the program, but then we
Right.
got creative when it came to the
Dynamic
actual
stuff. Yeah.
work specific stuff.
So that's kind of like the return to sport, right?
Yeah,
So it's like
exactly.
it's
Exactly.
it's literally return to sport, but return to work.
Yeah.
Right?
Yeah.
Because it is an active activity. And I think it's just good for people to understand and know that, there is a kind of an integration process with that. Like you get strength, you get your strength back, but then there's also the specific work duties that you have that may be dynamic in nature that you do also have to prepare for.
Mm-hmm.
So if you prepare for those, one, it's just going to make you more confident in your ability. And with that, with law enforcement, you don't want to have to think whether or not, because that could be life or death.
Yeah.
But with what you were saying too, like again, you need to make sure you do that part of the process too,
Mm-hmm.
because if you didn't prepare for that part of the process, and then you go to draw and boom, that happens, or you take an impact, somebody like trips you up, you fall on the ground or something like that, you try and brace and you can't get that impact or whatever, or you fall on somebody,
Mm-hmm.
chasing them down, they trip, you fall, whatever it may be, some type of random impact, and you didn't prepare for that.
Right.
You didn't strengthen that. So yeah, no, it's really good that you reinforce that area, because that's something that I know you always mention that it's sometimes missing when you do go to those clinics, and it's not them specifically, it's just like the time frames that they get with their insurance.
Right.
So understand this too. We're not talking just about the clinician side of things, but we're talking about the insurance side of things. Sometimes insurance doesn't give you enough time to fully prepare for everything that you're going to experience once you get back into your work or your sport. But in this specific case, back to work.
Mm-hmm.
Um, so yeah, the next thing that I wanted to ask you about this specific case was after, those two visits with you, that he ended up canceling his insurance PT completely. Like what changed for him physically and mentally like that fast that he wanted to go ahead and cancel?
Mm-hmm.
Like what was he seeing in your treatment that, he didn't get
Yeah.
from the other place?
Yeah, and I forget how many visits were like overlapping, right? But like you said, I think that his range of motion was coming back a lot quicker with me. His pain levels were decreasing a lot faster. And then he was also just felt like he was being challenged, right?
Okay.
And we weren't challenging beyond the capacity of the shoulder because we weren't increasing pain. So he was kind of seeing the difference where it's like, we're not using the 1 pound weights, and he's like, oh, I can tolerate this, like, because I'm not nothing negative is happening. So why am I not getting this at the other place? And I think that's kind of where why it boiled down, is that the comparison of the two. And also, like, he was like, the fact that you can spend 60 minutes with me and just me is, you know, anyone will be able to
Yeah.
tell the difference in quality at that point.
Yeah.
But yeah, like I said, I think he just started comparing how quickly he was progressing within a couple sessions, versus where he was feeling stagnant in the other place.
Gotcha.
Yeah. Mm-hmm.
So if you could kind of summarize like what made this recovery so successful, what would it be?
Yeah, I think that the individualized care, right? So not everyone progresses at the same speed, right? So maybe his protocol would have not been so stagnant for someone else, right? And that's okay. But for him, the protocol wasn't working. And that doesn't mean that we go from like 1 pounders to 15, right?
Yeah.
It may mean that we have to change the exercises so that he continues to progress within the stated protocol, the surgical protocol, right? But I think, like I said, I think that individualized care, being able to just have an individualized conversation with the client without being all distracted, is really what pushes the needle when it comes to treating these people. And it also uncovers things. Like I said, it makes the process, I know exactly what he needs to get better, because we talk about it, versus like, we just need to get you full range of motion right now. Yeah, we do, right? But everyone is different.
Yeah.
And like, what is he experiencing? Like, maybe we're missing something that will push the needle into him progressing or getting out of pain. The dude needs to sleep tonight. How can we get that? You know what I mean? But you wouldn't know that unless you got to sit down with him and have a conversation. So I think, like I said, I think the individualized portion, that one-on-one, is really important when it comes to higher quality care.
Gotcha.
Yep.
Yeah. And I want to emphasize too, like, so we work in cash based, but there's also insurance based places that do one-on-one care as well. So do understand that, like, you can still get one-on-one care not only with cash based, but also with some specific clinics that do insurance based, but they are still also limited on the type of treatment that they can give you based on the insurance. Because again, that's another benefit that we have in the cash based space, is that we can treat at our discretion, like what we deem is best and going to get you the quickest results, and the best outcomes, basically the best outcomes for you, not the best outcomes for insurance.
Yeah.
Per se. Okay. So for someone out there recovering from a surgery and frustrated, what would you say to them?
I think, yes, there are financial barriers. I think that maybe there just needs to be an evaluation of like, what is it worth to you, right? To get back to whatever you need to get back to. Maybe that's your job that feeds your family. Maybe that's your sport that you love, whatever, right? And again, I being a cash-based clinic, I fully understand the financial limitations that can be there. When you compare it overall, you go in 3 days a week. If you have a copay, like, let's do the math. And, if I'm going to get you better faster anyways, like, is it really that different? I'm not so sure, but we're not going to get into that.
Yeah.
But I think, you just have to sit down and evaluate what the highest quality of care means to you, what your health means to you. And I think once you start looking at your health and what you do to it as an investment versus an expense, that will get you to understand the importance of high quality care.
Yeah, definitely. And once you experience it, it's a whole nother world. But at the same time, like, looking from an outside perspective, you're questioning whether or not it's going to be, like, is it going to be worth it?
Yeah,
When
it's a
I
lot of
can
money.
get this here. And I think it's good to hear cases like this. Also, like, why we do these episodes, that so you can understand like all the things that go into physical therapy, and you can be educated on the process. So that way, when you do go into a place, you already know like a little bit. You're just like, this isn't even holding up to the standard that I listened to on a video.
Yeah, right.
You know what I mean? But when you go into these places, like you got to be your own advocate as well, right?
That's
So it's
fair.
like asking these questions, like ask, what is the plan to progress me weekly, right? Literally, it's not like you're challenging these people, and if anybody gets offended by that you're working for, their ego is kind of taking over instead of like your actual care. You know
Yeah.
what I mean?
Mhm.
Because it is your care, your health is in their hands, so you have the right to
Yeah,
ask these questions.
you do.
So ask, what's the plan to get me back? What does that look like if they're not already explaining that to you? Um, if you need more attention, like ask for that more attention. You know what I mean? Like if they're spending all their time with one person, and sometimes they may just be like they may just like that other person a lot more,
Yeah.
demand that they come over to you, and maybe you might need to be a little bit more approachable. Because like no, like seriously, it's a thing that we don't think about, but our personality going into a medical facility plays a huge role into how we might actually be treated
Mhm.
too.
Mhm.
So you want to think about going in if you're I understand you're in pain, but at the same time, if you're just like, this is all the money I have and I have to go into this place and I want to be treated the best I can, you better treat those people because they're probably already going through it with a ton of other patients.
Yeah.
Treat those people as nicely as you can.
Yeah.
So that way maybe they might lean a little bit more towards you as well. Just a little trick there. Just a little
Yeah.
trick.
I mean, it's good practice to be kind no matter what,
Right.
right?
Right.
Dang.
Even when you are in pain, right? Hey, we could say we're in pain, but could be worse.
Yeah.
Could be worse. Um, and then measure your outcomes too,
Mhm.
right? So like what are your outcomes? Like, do you feel like you have less pain? You can do more from day to day. You are waking up with less overall pain. You got more range of motion. Just understanding like these specific things. Maybe ask them like, what are we looking to improve on if they didn't already express this to you?
Yeah.
So that way you can get all that information. One, it not only helps you understand the whole entire process and what it's going to take, so you are mentally prepared for it, but it also helps them, let make sure I'm on my game
Yeah.
too.
Mhm.
So you upgrade the standard of care that you're actually getting there too.
Yep.
And you also do a service to the people that are coming behind you,
Mhm.
by doing that. So, it's like that full circle thing that we were talking
Yeah.
about, that pain
Yep.
cycle, but this is the full circle on like how we can improve this whole entire system. Because again, we're not trying to bash this, insurance based or anything like that, but we want a better quality of care to be able to be provided in those areas as well.
Yep.
So that way everybody can have these outcomes, because not everybody's going to come to us, and that's perfectly fine. But
Mhm.
as long as we're giving education on like the process and how you can approach it in a better way, so that way you can get out of pain, and also those clinicians can be able to practice a lot better. And then maybe people take action and they're just like, hey, how do we get down to only maybe just seeing two people,
Right.
and where we don't see that many more people? You know what
Right.
I mean? How do we actually adjust our approach to when we see those two people, to where now those two people that we see, we make sure each one gets the care that they need
Mhm.
based on what they have going on too.
Mhm. Yep.
But that's my little rant, my little soapbox. We'll probably do a whole nother episode about just physical therapy and the care that's provided. But yeah. So if you do have some type of rotator cuff injury or something like that, or you're post op or whatnot, and maybe this is you and you've been going through this process right now, and you're not seeing the results that you want to see, reach out to Redemption Physical Therapy. Go to redemptionphysicaltherapy.com. Go get a free call, consult with us, and we'll see if we can help you get on the right track, or at least give you some guidance on where you can go in order to get on the right track. Okay, but as always, thank you for listening, and we'll see you in the next one.